Hello, everyone. We are back today with Beth Rose from AKEDA and Yolanda and Rachel and Dr. Lusher and Dr. Evans to talk to us today about telemedicine. Beth Rose is a co-founder of the Alaska Eating Disorders Alliance, AKEDA, a new nonprofit that was formed in September 2019. Both Beth and her co-founder Jenny were members of the same book group for more than 15 years before they discovered that they had each had an eating disorder when they were teens and that they each had a child who was struggling with an eating disorder. With firsthand knowledge of the difficulties of navigating this complex, frightening, and overwhelming journey alone, they decided to launch AKEDA to ensure that Alaskans would have local connections, resources, support, and a community to address eating disorders. AKEDA's programs include education and outreach, support groups, advocacy, and body positivity initiatives. The Alaska Eating Disorders Alliance is proud to be a member of the NEDA network, and Beth is excited to be a part of this program and to talk with fellow board members, Dr. Rachel Lusher and Dr. Evans.
Have this? Are
Go
we
ahead.
live?
Yes.
Okay, I'm just so glad we're able to do part two and a look at healthcare in Alaska and how doctors and treatment teams are meeting the needs of communities in more remote areas and even some urban areas through telemedicine. And our featured speaker today is Dr. Yolanda Evans, who has been involved in developing and providing telemedicine since 2011. So we're really fortunate to have her with us. Dr. Evans is a member of the Division of Adolescent Medicine at Seattle Children's Hospital, an associate professor of pediatrics at the University of Washington School of Medicine. She grew up in Alaska, yay, and earned her MD from Oregon Health and Science University and a Master of Public Health degree at the University of Washington. Dr. Evans completed her fellowship in adolescent medicine at Seattle Children's Hospital and the University of Washington. Dr. Evans provides care to patients in Seattle, Everett, and Olympia, Washington for a variety of concerns, including eating disorders, obesity, reproductive health, and ADHD. She offers consultation via telemedicine with the Alaska Native Medical Center for the management of adolescents with chronic illnesses, eating disorders, and gender-affirming care. Her clinical and research interests are in the areas of technology used to reach adolescents and their families, including the use of telemedicine and video conferencing for patient care. And from 2011 to 2019, she was the author and editor of the parenting blog, Teenology 101. So she's going to be interviewed today by Dr. Rachel Lusher, who we heard last Friday, and who is a pediatric endocrinologist in Anchorage, Alaska. And Dr. Lusher grew up in Missouri and attended college and medical school at the University of Missouri-Columbia. And then she completed her pediatrics residency at the University of California, Irvine, and then moved back to Missouri to complete her pediatric endocrinology fellowship at Washington University in St. Louis. In Alaska, she moved back to Alaska in 2011 to provide pediatric endocrinology care for the Alaska Native Tribal Health Consortium, which we heard about, which is a unique tribal healthcare system that serves Alaska Native and Native American people throughout the state of Alaska. So I'm grateful that both Dr. Evans and Dr. Lusher are here today, and I'd like to turn it over to Dr. Yolanda Evans to start today's conversation.
So, thank you so much for the introduction, and I'm very excited to be back and to tell the listeners a little bit about the work that I've done over almost a decade. It's amazing how time goes by. And so let me just pull up some slides really quickly. And so I'll just talk a little bit about telemedicine and kind of where I've seen the progression of things over this last bit of time. So I'm at Seattle Children's, and telemedicine there started in 2001 through a grant where they were really trying to expand the reach of services to providers in what we call the WWAMI regions, so Washington, Wyoming, Alaska, Montana, Idaho, so a really broad geographic stretch that includes a lot of rural health, rural medicine, and a lot of places are hard to reach. So that grant was obtained by Dr. Sandy Meltzer and Dr. Kathleen Myers, who are two mentors of mine. And then in 2005, the funding ended, so the hospital really worked to build the infrastructure to keep the service going, because they realized how valuable it was to be able to have the opportunity for specialty pediatric providers to reach patients who might not be able to get the care they needed. And so in 2011, I took over as the medical director of telemedicine and really helped try to continue to improve on the infrastructure for having the services available. And at the time, there were so many challenges to providing care. One of the big challenges was cost, because the equipment was quite expensive. Now, this is in the time before everybody had video chat on their phones and everything. So clinics, we had to ask clinics to either purchase equipment, which could have been like a mobile robot, or on the bottom of this slide, you see some of the hardware, so dedicated monitors with cameras. And these things were upwards in the thousands of dollars to purchase. And so either the hospital would purchase for a regional site, if it was an affiliate, or if it was a private place or a company or a hospital not affiliated with Children's, they would have to purchase the equipment. There were also a lot of challenges around state licensing, because there weren't state compacts to expedite licensure. So for telemedicine, the provider has to have a medical license to practice wherever the patient's located. And then billing was challenging, because in order for us to be able to get reimbursed, you had to have an MD or DO. And so working with a full multidisciplinary team, it meant that some of my team members weren't even able to bill for the services that they were providing. And then there were a lot of challenges with providers just being able to incorporate seeing patients into their usual clinic flow, partly because you needed this expensive dedicated equipment. If it wasn't at the site they were working in, it meant that the provider might have to go to a site, or they just saw it as kind of cumbersome to go through all the steps to be able to provide the service. So all of these things were challenges that were in place when I started and when the initial grant started. But despite that, we still continue to push the envelope of it and to launch telemedicine services in the WWAMI region. And I've been really fortunate to be able to work with Dr. Lesher in a really unique clinical format where we are able to provide care to patients in Alaska. And I think, thinking about the current pandemic and how that's really changed the landscape, many of the challenges that were in place before are gone now. So like the equipment that you need is just a laptop or a smartphone or a Surface. And I think one of the biggest changes is being able to provide care direct to the patient's home now. And so it's just amazing to see where we are, and I'm very excited to see where telemedicine continues to go in the future. And I think, we're always going to need the face-to-face contact with our patients and providers. And of course, we can't do everything via telemedicine, even though with a lot of the technology that's out there, there are like peripherals, we call them, or devices that use Bluetooth, like stethoscope or different instruments. But when providing care to a patient's home, obviously we don't have access to those either. So there are always going to be safety issues and reasons that people need to come in. But really now that providers and patients are more comfortable with using technology, that we've really been able to ramp up our infrastructure to support scheduling and all the logistics for having telemedicine run a bit more smoothly and integrating it into our clinic schedules. I think it's here to stay, and we're going to continue to create new ways and pathways to get people the care that they need. So I didn't have a whole lot of slides because I wanted to just have a conversation. So Let me stop my screen. Okay. I think I did that right. Yeah. Thank you.
Thanks, Yolanda. That was really interesting. How did you get involved in telemedicine or
Yes.
interested?
Yeah, so as Dr. Rose said, I grew up in Alaska, and I knew going into medical school that I wanted to serve like hard to reach populations. And so when I ended up taking the job in Seattle, I specifically said I want to be a regional provider. I want to go to communities. I want to work where my patients live. And so was one of the providers who went to a variety of different regional locations, but I also really wanted to be able to serve the community where I grew up. And so reached out to providers in Anchorage to ask like if it was a possibility, and worked with them to really create the program.
And I know that you and I have really enjoyed being able to communicate with each other and regarding patients telemed and sharing patients in that way. What have been some of the ways that you're using telehealth for eating disorder populations specifically?
Yeah, so I know, so with us, we've been able to coordinate the referrals for eating disorders where if a patient's in Alaska and needs support, then I can see them virtually to offer recommendations, to complete an evaluation and offer recommendations. And then we've also been able to coordinate amongst providers, so where in real time we can talk through a plan for a patient and then I can see them. Then we can talk again via telemedicine, and then what we call a warm handoff, where that patient would then go right into an encounter, like with you, for example, Dr. Lusher. We've been able to also pull in like the behavioral health team or nutrition, just to make sure that we are all in agreement with the plan, that we are giving people the same consistent recommendations, and that care is really safe.
Are there any things you've been doing in Washington, like with your larger team, that you think others could apply to their own practices?
Yeah, I think one of the really, really amazing things that's happened with all the changes in telemedicine recently is that we're doing more team visits. So I'm the provider. I'm able to pull in social work and nutrition and nursing, and we might all start our virtual visit together, similar to this format where we've got the patient and then like 4 different team members who are meeting with them and introducing ourselves and gathering history. And then we'll be able to have the patient then wait in the virtual waiting room while we discuss a plan. I think one of the other big changes is we've involved the trainees too. So I work with resident pediatricians and fellows who are doing subspecialty training. And so we've been able to do coordinated visits with them as well, where I am, as their supervising physician, able to sit in on the visit and give real feedback as well with care and help with resources. And I think having all the team members in place in that virtual environment is just really amazing to be able to give recommendations and resources and advice for patients and families in real time, even though they can't get to us.
What have you gotten any feedback from patients or their families themselves about the challenges and or the benefits of being able to do telemed at home during this coronavirus pandemic?
Yeah, I think some of the challenges have been like we haven't been able to have them come in for vital signs and physical exam, but we've also created really detailed instructions that are easy to follow for family members to be able to help us with that as well at home. And so really a lot of coordination between family and nursing to get the information we need to provide care. But the systems all have glitches. Sometimes things drop calls or there's feedback delays. And so I think that's some of the feedback we've gotten is like, the technology was good, but not excellent all the time. But still, their families are very appreciative that we're able to provide care.
So I can't believe that we've already run out of time. It's just like a conversation that we need to have. Maybe we'll continue it some way in another time, maybe offline. But I just want to thank you both. This is just the tip of the iceberg in terms of being able to talk about telehealth and especially about this team approach. But I just want to thank both Dr. Yolanda Evans and Dr. Rachel Lesher for joining us today and for your wisdom and your experience in this area. And so grateful for your work and for helping all the many patients. So I think I just want to say thank you and appreciate everything you're doing.
Thank you.